How does STDs influence the celibate lifestyle in Houston, Harris County, with a focus on HIV, AIDS, gonorrhea, and chlamydia? According to the 2013 Houston Area Integrated Epidemiologic Profile for HIV, AIDS Prevention and Care Services Planning, the Houston eligible metropolitan area has over 5 million residents. The EMA contains areas which has over 500,000 residents, in addition to over 2,000 reported AIDS cases. During 2009 to 2011, 2,793 people were diagnosed with AIDS. In 2011, EMA's population was 16.9% African American. African Americans also had 50.5% of new cases of HIV. Total population of people living with HIV was 50.1%. In 2010, the Houston-Harris County area had 1,235 new cases of HIV, with 54.5% of patients African American, compared to 1,249 in 2011. In the EMA, 1,334 people were diagnosed with HIV. The report also discussed how Houston-Harris County had 20,022 diagnosed with HIV. 10,000 of those diagnosed were African American. In the Houston metropolitan area, 21,664 people are diagnosed with HIV. Next, the report said Houston-Harris County has higher rates of new cases, prevalence, and deaths compared to the state. The Houston-Harris County rates exceed the Houston eligible metropolitan area. The report also cited DSHS, Center for Health Statistics 2001 population projection, which discussed the prevalence of African Americans with HIV in the EMA. Finally, the report discussed how African Americans have the highest incidence of chlamydia and gonorrhea in Houston. One of the major conflicts is the individual definition of celibacy. People have different perceptions about what's acceptable and unacceptable when going without vaginal or penile penetration. According to Anderson, the modern generation is creating their own sexual standards. Manning, Giordano, Longmore, and Flanagan also discuss risk management. Risk management also varies individually. Manning, Giordano, Longmore, and Flanagan also discussed how risk management involves the following. Number 1, asking questions about your partner's past sexual behavior. Number 2, consistent condom contraceptive use. Number 3, sexual exclusiveness. Number 4, disclosure of current sexually transmitted diseases and infections. And finally, the ability to communicate with partners about risky behaviors. According to Pittman, Houston ranked 9th in HIV diagnosis in the United States in 2013. Next, using Google Trends, celibacy has had an increase in search volume since 2011, with a spike in 2013 involving a scandal with a Catholic priest. There also has been an increase in search volume for HIV, AIDS, gonorrhea, and chlamydia in Houston within the last few months. The article has educational value, human interest, relevance, and consequence. First, educational value. People can learn more about how HIV, AIDS, gonorrhea, and chlamydia affects Houston and Harris County, in addition to the Houston eligible metropolitan area. Second, human interest. The thesis will interview people who are leading a celibate lifestyle. Number 3, relevance. I have been celibate for almost 4 years. Consequence. Having sex may lead to sexually transmitted diseases or infections. Viewpoints will differ about the definitions of celibacy in addition to risk management. The story will have basis on government and academic research in addition to subject matter experts and people who are leading a celibate lifestyle. The story will not discuss my personal experience with celibacy and STD. I will not edit the footage to reflect a particular viewpoint. First, Frank Barker has experience with training and counseling individuals with HIV/AIDS. Barker can provide information about resources needed, such as additional funding and education. Next, Trainia Prosner is leading a celibate lifestyle. She also wrote Celibacy, What Was I Thinking?, which discussed celibacy and modern. The book is written from a Christian perspective. The book provides tips for maintaining a celibate lifestyle in addition to setting boundaries for dating and relationship. Prosner advocates abstinence until marriage. Most of the research research found focused on celibacy or chastity in the Catholic Church. In 2013, there was a scandal involving a Catholic priest. The scandal led to a debate whether or not priests should maintain lifelong celibacy. My target audience is African Americans in the metropolitan Houston area, ages 25 through 44, because this age group has the highest incidence of HIV and AIDS since 2011, according to the 2003 Houston Area Integrated Epidemiologic Profile for HIV, AIDS prevention, and care services planning. First, African Americans had 673 new cases of HIV in 2010, while 651 African Americans was diagnosed with AIDS in Houston Harris County. In 2010, there were 10,000 cases of African Americans with HIV. In 2011, there was 10,842 people living with HIV and AIDS. The thesis may help educate others on HIV, AIDS, and other sexually transmitted diseases. The thesis may also help provide additional funding to abstinence education, in addition to additional research on HIV, AIDS, and other sexually transmitted diseases.